Awesome. Thank you, Casey. Hello, everyone, and welcome. We're really, really happy you're here. As Casey mentioned, my name is Nicole Warschauer. I head up community over at Trusted Health, and we're really thrilled that you all are joining us tonight for a very hot topic in nursing, a very burgeoning discipline in the nursing world. And if you're not familiar with Trusted in particular, we are the place for the modern nurse. We have a host of travel assignments available all across the country. But on the community front, we also have a lot of resources for you in pretty much any regard for your career, as well as kind of like your fun personal life too. We do events like this for both your career, travel, nursing, lifestyle, specialty events. And obviously tonight we're tackling a little bit of the cannabis nursing industry. And so a couple things off the bat, we are recording. And so any questions that you have, you can number one, ask through the Zoom chat. So go ahead and use that chat, ask the questions there. We do have a really big crowd tonight, which we're thrilled about. And that's why try to stay on mute if you can and use that Zoom chat so we can float the questions over to Eloise. This is your chance to listen, learn, and connect from the expert of the hour. And then obviously 3 is get ready to learn about cannabis nursing. As I mentioned, we are recording and we also will share the recording and the slides after the fact. So if you miss a piece or you have to run out and get something to drink and come back, no problem. We have you covered and we'll share that within the next day or two. And one more thing, we are going to stop twice for questions. We are allotting 2 10-minute chunks for questions, and we'll let you know when that crops up. If you have additional questions after the event is over, Eloise is an incredible resource, and she has an amazing selection of courses as well as information and resources on her Radical Health site, which we'll talk about in a hot second. So with that, I will kick it over to Eloise.
Well, thank you both, Nicole and Casey, for having me here with Trusted Health. I'm really excited to present on this today, and welcome to everybody. Good afternoon, good evening, wherever you are at. All right, so let's see what we're going to talk about today. Well, we want to first define what is cannabis nursing. That's the question I probably get the most. What does it mean to be a cannabis nurse? I'm going to talk about the National Council State Board Nursing Guidelines. They actually design our NCLEX, so we'll talk about the guidelines they put out around caring for the patient using medical cannabis. We'll do a little bit of Cannabis 101, some clinical implications, cannabis consulting, how to further your education, and of course, barriers and challenges that are unique to this industry. So I am a nurse practitioner here in California. These initials after my name mean that I'm an adult geriatric primary care nurse practitioner board certified. So my practice in California is Radical Health Clinician Network. I started that in 2014 because I really wanted to help patients navigate cannabis as a medicine. So my physician collaborator and I started this practice, and since then I'm close to seeing about 7,000 patients who want to use cannabis as a treatment modality. I also started Radical Health, which I'm the CEO of as well, and that is our training and education company that we started as a result of many nurses and other healthcare professionals coming to us who wanted to learn more about cannabis and how they could incorporate it into their nursing career. I'm also the president of the American Cannabis Nurses Association. We are a nonprofit nursing organization with about 1,400 members across the nation. And we just celebrated our 10th anniversary last year. And I'm also the chief nursing officer for Leaf 411, which is another nonprofit organization out of Colorado that provides a free cannabis nurse hotline for the public. So anybody can call that Leaf 411 number and talk to a registered nurse who has been specifically trained in cannabis to help them answer many of their pressing questions. I'm married with 2 kids, live here in Concord, California, and I'm what you call an extreme puzzler. Of course, with COVID, I think I've probably done 15 1,000 piece puzzles in the last year. All right, so what is cannabis nursing? The American Cannabis Nurses Association actually designed scope and standards around what is cannabis nursing. And the reason we did this is because we're actually trying to get credentialing for cannabis nursing, just like we do for medical surgical, cardiovascular, oncology nursing. So the first step working with the ANA was to develop these scope and standards. So we actually had to define what is cannabis nursing. And the cannabis nurse aims to not only support and educate patients, but also to work towards supporting wellness and healing through a caring presence, which supports the patient's needs. It also requires that the nurse is educated in multiple areas above and beyond all registered nurse competencies. So this includes knowledge of the endocannabinoid system, cannabis therapeutics, cannabinoids, terpenoids, cannabis laboratory testing requirements, potential medication interactions, advocacy, ethics, and the law. And we also believe that the cannabis nurse's role expands as he or she acts as an advocate, coach, and navigator to guide patients through a sea of cannabis information and misinformation. The cannabis nurse is a leader in guiding patients towards a maximal state of homeostasis through upregulation of the endocannabinoid system. And lastly, the cannabis nurse practices self-care to maintain a professional and caring presence with patients. So the National Council State Boards of Nursing came out with their guidelines in 2018. And on the next slide, you'll be able to see the journal in which it was published. And what they said when they came out with these guidelines was that nurses need practical information to care for the increasing number of patients who utilize cannabis and who self-administer cannabis as a treatment for various symptomology or for recreational purposes. Individuals are using cannabis and nurses will care for these patients. So they recognize, I'm sure as many of you that may be here today, that our patients are using it and we need to be prepared to help them navigate this new territory. Oh, my slide's not advancing. I seem to have lost control. Casey, are you? Thank you. Oh, wasn't there another slide before that? Yep, we lost a couple. Okay, so the National Council State Board and their guidelines on how to care for the patient using medical cannabis came out with 6 principles of essential knowledge. And again, this is in the journal that you can find. And this is considered a mandate. So it's not actually required that our state nurses, boards of nursing adopt this, but this is, they strongly suggest that they adopt it. So the first is that nurses shall have a working knowledge of the current state of legalization of medical and adult use cannabis, that the nurse shall have a working knowledge of the jurisdiction's medical cannabis program. The nurse shall have an understanding of the endocannabinoid system, the receptors, ligands, enzymes, and the interactions among them. The nurse shall have an understanding of cannabis pharmacology and the research associated with medical use of cannabis. The nurse shall be able to identify safety considerations for patients' use of cannabis. And most importantly, in my opinion, is that the nurse shall approach the patient without judgment regarding the patient's choice of treatment or preference in managing pain and other distressing symptoms. So I want to talk just a little bit about Cannabis 101, because when I came to cannabis as a medicine, the thing that I found the most fascinating, of course, was the endocannabinoid system. This regulatory system wasn't discovered until the early 1990s. So really, we're just catching up as a scientific community with what is now thought to be the most important regulatory system in our body. In fact, the endocannabinoid system receptors are the most abundant receptors out of any other receptor cells in our body. And the endocannabinoid system is responsible for maintaining homeostasis. So it regulates our mood, our appetite, our sleep, our pain perception, and our memory. And we now know that the endocannabinoid system is found in all vertebrate animals and some invertebrate animals. And we've identified at this point 2 cannabinoid receptors, CB1 and CB2. And the homeostatic effects produced by CB1 stimulation includes an increased drive to sleep and eat, a reduction of perceived pain, fear, and anxiety, a maintenance of well-being, and the promotion of recovery during stress. And there are very few CB1 receptors in the brainstem or in the cardiorespiratory centers, which accounts for the absence of a lethal dose with cannabis. Our CB2 receptors are primarily found in the immune system. Many of you may have been hearing about how cannabis can help with inflammation. And that's because the homeostatic effects produced by CB2 stimulation include a reduction of the release of inflammatory mediators and a reduction of immune cell migration into the brain. We do actually have what we call synthetic cannabinoids and plant cannabinoids. So the FDA has approved 3 cannabinoids that can be prescribed in the United States. Now, remember, cannabis is a Schedule I drug, so we cannot prescribe the actual plant. Dronabinol, also known as Marinol, was approved for nausea and vomiting and appetite stimulation in the 80s, mainly around the AIDS crisis. It's very expensive. The average dose is 2.5 to 20 milligrams per day, and it is synthetic THC that's derived in the lab. It does not come from the plant. Nabilone is the same. It's derived synthetically. It's only THC. It has nothing else in it. And it can run about $1,000 a month, sometimes more for patients depending on their insurance coverage. And most patients will report that they feel more side effects than they do benefit from this. And that has to do with how it interacts with those cannabinoid receptors. I won't get into too much physiology, but synthetic THC is a full agonist at that CB1. So we tend to have more side effects when it's a full agonist versus THC from the plant, which is a partial agonist. And then in 2018, we had Epidiolex. Epidiolex was approved. It's cannabidiol or CBD. It does start from the plant and it is refined into essentially a CBD isolate. And it was approved for 2 seizure disorders with the average dose between 5 milligrams to 20 milligrams per kilogram. And we definitely see this running around $3,000 a month for patients, sometimes even with insurance. I keep losing control here, ladies. I'm sorry.
It's
Thank
totally
you so much.
fine. I think it's probably just maybe your internet connection or something.
Okay. So the cannabis plant, which we call phytocannabinoids, actually we found about 113. I've also seen some reports of 140 to 150 of these cannabinoids or molecules found in the plant. And the 2 most common are THC and CBD. THC is the part that produces euphoric effects, alters our behavior and consciousness, alters our mood and our perception. And it's definitely the cannabinoid that most people fear. So when my patients come to me, the most common requests are, I don't want to smoke it and I don't want to get high. But we'll talk a little bit about what that quote unquote high looks like for them. With CBD, it is a mood altering substance. It's an antipsychotic, it's an anti-anxiety, an antidepressant. So we're seeing it work a lot for these different conditions. We now know that we have 37 states plus the District of Columbia that allow for some medical cannabis use. We have 15 states plus DC that allow for adult use. And we have 12 states this year alone that have cannabis legalization on the ballot. And COVID really helped drive that because as these states started to lose tax revenue from other things, they're really reconsidering legalization to help bring in tax dollars again for their state. And this is definitely an area where cannabis nurses can come in and be great advocates, because what happens with, of course, legalization is the tax rate goes up and patients start to really struggle with affordability. This is a great map. This really, for me, is a way for us to demonstrate the train has left the station. I mean, we can see by this color-coded map here that most states are allowing for some form of either CBD or medical or adult use cannabis, with Idaho, and I believe that's Nebraska, being the only states that don't allow for any type of cannabis, including hemp-derived CBD. So we know that marijuana is considered a Schedule I drug. Hemp, or what we're now considering high CBD, was descheduled in actually 2020. It was originally came out as a Schedule 5, and then they descheduled it last year. And CBD is still considered a Schedule I drug, which is very confusing. So we had the Farm Bill in 2018 that descheduled hemp. Oh, I'm sorry, I was thinking of Epidiolex, you guys. Let me back up. Hemp was descheduled in 2018 through the Farm Bill. And essentially that allowed these companies to start making CBD and selling it on the internet. And when this happened, the DEA and the FDA came out and said CBD, whether it comes from hemp or not, is still considered a Schedule I drug. So this is very confusing because Epidiolex has been descheduled, which is CBD, and Marinol is a Schedule 3 or 2, and then Nabilone, the other one, is either a Schedule 2 or 3, and marijuana is a Schedule 1. So you can see that we're all over the place in terms of scheduling these different cannabinoids. It's not my internet, it's when, if you don't mind advancing the next slide for me, please. I lose my little cursor.
It's yours. Sometimes it just takes a moment.
Oh, it is? Oh, okay.
Like, yep,
okay.
It's all, you've got it. You've got control.
I thought you were giving me the magic back there when it
No,
popped up.
you
Okay.
have the magic.
So hemp-derived products, I do want to spend a little bit of time talking about this because this is the biggest area where people get confused and the biggest misconceptions out there and the most misinformation around this. Our patients right now are hearing all about CBD. You know, it's emerged in the last 10 plus years, and because it doesn't produce that euphoria, most people are comfortable with exploring CBD first. And so with the Farm Bill descheduling hemp in 2018, we see this emergence of products. So hemp-derived plants can flower just like the marijuana plant, but hemp is mostly grown for its industrial uses. So the stalk and stem have been used for things like rope and textiles, concrete, paper, and a variety of other uses. But the flowering part of the plant is best for producing the medicine. And farmers are growing cannabis that is defined as legal hemp. With that definition, has to have THC at 0.3% or less at dry weight. So they're using these techniques to emphasize the promotion of CBD from flowers. So if someone is going to purchase a CBD product online or in a CBD store or in a health food store, it's really important that they find products that are derived from the flower and labeled as flower-derived CBD. It's also really important now because there's over 3,000 CBD products on the market, and we just expect that to grow. So when you're looking at products, if your patients are curious about using it, there are some really important things that they need to consider because it's not regulated yet. CBD on the market, in stores, on the internet, is not required to go in through any regulatory process or testing. But there are a lot of companies out there that are trying to do the right thing. So look for companies that are using independent third-party testing facilities. And they usually put a little QR code on their products that if you scan it, brings you right to that product testing page. So you really want to make sure that you know how much CBD is in there, how much THC is in there. Does it have molds, pesticides, fungus, things that could potentially harm our patients if they are immunocompromised? Make sure that they're using safe extraction methods so they can take that flowering part of the plant and use heavy chemicals to extract the oils off of it, like acetone, isopropyl alcohol. So we want to make sure, again, that our patients aren't putting anything into their body that could be more harmful than beneficial. And we encourage looking for products that are derived from high resin cannabis grown sustainably and under organic conditions. And we also recommend avoiding products that have toxic additives. So a lot of times these tinctures, these liquid forms of cannabis, can taste like the plant. They have a very earthy taste to them. So some of these companies will add in flavoring agents or try to make it another color. And sometimes those additives can be toxic. You want to make sure these companies aren't using any explicit health claims. So it's against the law for them to say that it's going to cure cancer or cure your pain or cure your insomnia. Again, make sure that these cannabinoids were derived from the flower and not from the seed and stalk of the plant. And make sure that if they are providing what we call a certificate of analysis or COA, that is within the last year. You'll see some of these companies, either they don't list it, and if they don't list it, I move on, or if they list it and it's from 2018 or 2019, I also suggest moving on. Okay, oops. So one of the questions I get a lot is, what can I use cannabis for? And there are over 250 different conditions in which we've seen THC and CBD effective. A lot of those studies are in animal models, so we're really lacking research in double-blind, placebo-controlled studies, that gold standard, using cannabis for different conditions. But in 2017, the National Academy of Sciences came out with their report on the health effects of cannabis and cannabinoids for different conditions. And when they looked at chronic pain, they said that there was conclusive evidence that cannabis or cannabinoids are effective for the treatment of chronic pain in adults. And in fact, they found that CBD was shown to be effective at reducing inflammation, modulating pain, boosting opioid analgesic effects, and shifting the dysphoria associated with pain. We also have more research emerging on anxiety and depression. And what we're seeing now is that there are a lot of people out there that are self-medicating with high THC for depression. In fact, a study in 2016 found that 50% of cannabis users were seeking relief from depression, depressive symptoms. And this is an area that we have to be a little bit careful because chronic use of THC can sometimes cause what we call a biphasic effect. So they may initially be using it for depressive symptoms or anxiety, for example, and high THC use and chronic use can actually make those conditions worse. And these patients are actually trying to treat the condition, but they don't realize that they need to decrease their use to help the anxiety and depression get better. And we also found in 2018 that our endocannabinoid system is playing a significant role in regulating our mood, and that if that endocannabinoid system is dysfunctional, it may be contributing to depression. Just waiting for my next slide to go. There we go. It just goes so fast that I missed one. Insomnia and sleep issues. The National Academy of Sciences also came out and reviewed cannabinoids for sleep issues, and they found there was moderate evidence in the medical literature that cannabis and cannabinoids are effective at improving short-term sleep outcomes with sleep disturbances associated with obstructive sleep apnea, fibromyalgia, chronic pain, and multiple sclerosis. And these are the top 3 reasons people come to see me. It's either for pain, sleep, anxiety, or depression, and sometimes they're all sort of interwoven with that. I think we're going to start taking some questions here and do a little pause.
Awesome. We already have several questions ready for you, Eloise. Actually, we're going to start with not a question. I just wanted to share this with you because it's great feedback. This isn't a question, but more of a comment. I had applied and got accepted into a program at Pacific College before this webinar was posted, and this affirms my passion for learning more about this. Thank you so much for being a trailblazer in this practice. So kudos to
Thank you.
As well as someone else shared, thank you for having bravery I was unable to have before me. I'm not quite sure, but you are an absolute inspiration. So
Thank
we have a lot
you.
of really appreciative for the information you're sharing with us tonight. First question is a great one to ask. I think it's where can we find valuable info on the use of medical cannabis? It seems that a lot of information I find on PubMed or other scholarly databases seem to be biased against the use.
The question is, how do you find good research that's not biased towards, because it's true, in nursing school, we're not taught about the endocannabinoid system or cannabis unless from a perspective of abuse, right? Substance use disorder. There's actually a company called Cannakeys, CANNAKEYS, and they are the go-to scientific database where they, go in and find all of the research. They've gone back, I believe, until 1990 something, and have thousands of articles that they put together for you on different conditions. You can go in and pick the medical condition. That's a great resource because it's unbiased. You can also find pro-cannabis crusaders out there that will also cherry pick the information that's very, pro-cannabis. And I think truly, we've only studied the plant from an abuse or an addiction perspective. So it is definitely biased, but I think we're going to start seeing more and more research come out in favor of cannabis.
Okay, awesome. Thank you so much. So I don't know if everyone saw, but Nicole just shared in the chat that resource that you can check out later. Let's see. This is a question. If the synthetic has more of an effect, why are we making it in the lab when we have plants provided?
Such a great question. And I think, one of the true medical cannabis pioneers is Alice O'Leary Randall. And her husband, he was diagnosed with glaucoma at the age of 23. And he found that when he, took a puff off a little, joint, that his vision got better. So he actually fought the government back in the 70s to be able to use government issued cannabis that was grown out of Mississippi. And then when the AIDS crisis happened in the 80s, I think the pharmaceutical companies rushed to come up with what she refers to as their pot pill. because they can patent it, right? And so there's definitely, we're going to see more pharmaceutical companies wanting to come into this industry to capitalize on synthetic. So there's some advantage to synthetics, although not very many. Obviously, in a situation where people don't have legal access, something like dronabinol might be their only choice that they can use legally. Some synthetic cannabinoids don't show up on a urine test, so some people will use them for those reasons. So, I'm much more for the plant, but those are just some of the reasons why we see synthetic forms.
Okay, thank you so much for that. This one's a little bit more involved. Is there observed up regulation or down regulation of the cleft receptors with the exogenous use? For example, is there any studies done on the use or discontinuation rhythmic protocols?
I'm not sure I understand that question. Can you read it again?
Absolutely. Is there observed upregulation or downregulation of the cleft receptors with the exogenous use?
I don't know what a cleft receptor is.
I'm not quite sure either. If you can clarify in the chat, we can cover it a little bit later in the event. Let's see, the next question. Does CBD help more with the depression and anxiety than THC does?
Most of the time I'm going to answer things like this with it depends. What we'll see is with our endocannabinoid system, remember the point of it is for homeostasis or balance. So if it becomes downregulated, then we can actually see increased depressive symptoms, increased anxiety. So THC has been shown to do that the most. We have a study where we actually were able to look, it's a very small study, I think less than 20 males who were chronically using it. But as soon as as soon as the study weaned them off after 4 weeks, their symptoms resolved. So CBD research is still fairly new, and I think that we are finding it's pretty well tolerated. A lot of people come to THC for the euphoric effects, which at low dosages, again, can improve your consciousness. People can feel more communicative with their family. They might feel more patient, more relaxed. Large dosages, again, that's that biphasic effect. Large dosages can actually make people feel depressed. They can become more anxious, more paranoid. Sometimes they can even hallucinate. So it's really important that if THC is going to be used, that somebody's being monitored by a knowledgeable clinician so that they aren't getting to that place where it becomes more side effects than benefits.
Okay, thank you for that. So there are several questions about where to get certified and recommendations on programs, the validity of programs offered online, the certifications that are circling around the web. I know that we're going to cover a little bit of this later. Do you want to address any of that now or wait?
We can wait and see if their questions are answered when I address it.
Perfect. Awesome. And then this is kind of a loaded question, but we knew we were going to get this probably during this event. For nurses who would like to use cannabis for their own reasons, being personal or recreational, do you see that being legal for us professionals in the future? Do you see drug screenings for CBD and THC continuing after legalization? And where does nurses stand now in the terms of permission to use cannabis?
I love this question. It's complex. So the National Council State Boards of Nursing did issue within their guidelines recommendations to states on testing nurses for impairment. And maybe it's something I can get to Casey and Nicole afterwards to share with the community, something we can download. The National Council State Boards of Nursing in their mandate said that they do not recommend in states where they have medical and adult use programs that they randomly drug test nurses for THC. When we consume THC, it is fat soluble. It loves to store up in our adipose tissue. So you could use it once and continue to test positive for weeks. So our current testing standard is not a test of impairment. And the NCSBN, they recognize that when they put out their recommendations. So their recommendations are to do an impairment test, not a test for THC, but a test for impairment. There are very few states that have adopted this, and pre-employment drug testing is still quite common, especially for nurses and healthcare professionals. And a medical cannabis recommendation does not protect us because, again, it's still considered federally illegal. So employers are allowed to follow federal guidelines, even if your state allows the use. We do see some states like California right now has a bill that they're trying to get passed where it would end pre-employment drug testing. Because what we find is many people just find ways to test negative, whether through abstinence or, some of the nurses and ACNA have shared some interesting ways that they have passed drug tests. So it's, we know that most people, if they were tested after employment, would probably fail those drug tests and potentially lose their employment. So most employers don't test after employment, right? So it's just a very muddy system. And I know at the American Cannabis Nurses Association, it is one of our initiatives that we're working on this year as a position statement that we want to provide our members to bring to their state boards to help get this movement passed. So we can have choices, just like our patients, on what we want to use to treat either chronic pain or other distressing symptoms.
Well, thank you so much, Eloise. Those answers were incredible, and I learned so much in that first part, but I think we're ready to move on to the second part of the presentation.
Okay, great questions too. All right, so cannabis consulting. This is the Journal of Nursing Regulation, and this was this is where you can find the guidelines for the use of medical cannabis for our patients. So in here, they really do outline working within your licensed scope of practice. They talk about the pre-licensure, the licensed, and the advanced practice nurse. And again, it hasn't been adopted by a lot of states. So I always encourage people to reach out to your board of registered nursing within your state and start to have this conversation with them. And I know that initially, when I first started doing this work, when I reached out to California, they wouldn't even discuss it with me. I wanted to become a continuing education provider in this state. So when I taught it, that nurses could earn, continuing educations towards their license. And I had to fight them for about 8 months before I was finally able to get that approved. And it's just because they just sort of had this antiquated, mindset around it. They were uneducated. We've made a lot of progress since then. That was in 2016. And just think about our, within your scope of practice as nurses, we can educate, we can advocate. As an advanced practice nurse, I can diagnose, I can prescribe, although we don't prescribe cannabis. I'm going to give you some tips about how to stay within that. So we talk about focusing on serving size. I think an area where some nurses could potentially get themselves in trouble is if they said to a patient, take 5 milligrams of THC 3 times a day. That is considered like a prescription, right? Versus if they went to the dispensary and they got a package of gummies and you said, oh, okay, well, in each gummy, there's 5 milligrams. And most people have a good response at 2.5 to 5 milligrams. So you might want to consider half a serving size. So teaching them how to read a label, teaching them what an appropriate dose is and what to expect with those side effects is really within the registered nurse's scope of practice. In terms of seeing a patient, this is just a little bit of my process. So prior to the appointment, this is the information I want to gather on my patients. I really want to review their medical records. My goal when I started my practice was to bridge that gap between when they got their medical card. So in California, it was required up until 2018 to get a medical card from a physician to enter a dispensary. But that medical card from that physician never really provided them with any guidance. So they would go into these dispensaries and they were really quite overwhelmed and had, didn't even know where to begin. So I wanted to bridge that gap. So what I look at is their medical records, any test results or exams that are related to that reason they're coming to see me. So if it's they're coming to me for chronic pain and they've had an MRI, I want to review it. I want to see a list of their medications and supplements, a list of allergies, what other health history or conditions they might have, what they've tried, what kind of treatment history do they have? Do they have other morbidities? Have they used cannabis before? And what was that experience like? And do they have a history of substance use disorder either for themselves or within their family? At the time of the appointment, I want to talk to them about their primary goals. Why are they here to see me? Do they want to focus on pain, sleep, anxiety? How much are they sleeping? So sometimes we'll identify other things that might be cannabis might be useful for. How much water are they drinking and how much alcohol are they consuming? Because I work with the older adult population, alcohol is a recreational drug for them. And we want to make sure that their alcohol intake isn't excessive, as well as not, it's not going to potentially interact with their cannabis. Are they exercising? How do they manage their stress? Do they have a good support system? This is important because of the endocannabinoid system. Things like daily exercise, good diet, stress management, good quality sleep, good water intake, decreased alcohol consumption can all keep your endocannabinoid system within balance. And again, what is that cannabis experience in use? About 90% of my patients are cannabis naive. They've never used it before. So, a lot of education goes into that. And sometimes, of course, they had used it and they had a brownie experience or something like that. So we want to talk about, dosing and how to avoid that again. And employment status, because again, the taxes make cannabis really expensive. And I just want to make sure that I'm looking at products that are not only going to be safe and effective, but also affordable, and their education level. So that I make sure that I'm tailoring my instructions to their level of education and not, speaking in big terms. When I'm ready for my patient to use cannabis, the things that I want them to take away from the consultation is, when identifying these priorities, I also want to make sure that they are sharing in the decision-making process. Most of the patients that come to me, they are cannabis naive, and they're also a little bit reticent to start cannabis because the primary age of my patients, 76, most of them did not grow up in the 60s using cannabis. They sort of missed that. So they were raising kids or working, and then they spent their entire adulthood telling their kids and others to say no to drugs. So there's actually a lot of shame and guilt when they come to cannabis as a medicine. It's often a last resort. So I certainly don't want to push them into something that they're not comfortable with. And I want to make sure that they understand the treatment and that they're in agreement, because if they're not, their success rates are going to be pretty low. Really need patient buy-in. Starting them low and slow is really important too, because again, cannabis has these biphasic effects. So in low doses, it might help nausea, but if they take too much too soon, it can actually make them vomit. And we also want to make sure we don't miss what we call that therapeutic window. Cannabis is best when it's individualized. Prepare them for possible side effects. So again, low doses of THC can be euphoric. So they might get a little giggly. They might think things are funnier than usual. They might get a little bit of sleepiness. But most common side effects are dizziness and dry mouth, and they generally go away. Having them use a journal can be really helpful as well, because they can record their experiences and then look back and see the changes and progress that they're making. I always want to make sure that they're getting products that are tested for safety and efficacy. Again, because cannabis can be expensive, I try my hardest to make sure that they're not using illicit or street cannabis because it's not tested. Consider any drug-to-drug interactions, so that if they are on multiple medications, that we're preparing them for potential interactions. And consider focusing on one primary cannabinoid at a time. So for example, if they're coming to you for anxiety, maybe focus on a CBD regimen first, and then consider adding THC in, depending on how they're doing. It just helps you to control the variables and make sure that they're not, if they are having side effects, you can really determine which cannabinoid it is. All right, so now that we've kind of talked about all of this, you're probably like, okay, great. Well, how do I get all this education? Where do I even start? I've given you 3 different options depending on what you want to do. Radical Health, our training is self-paced. You can go on and buy different modules. We have our foundations, which is really like this 101. We have advanced sciences, and then we have some breakout modules that, cannabinoid hyperemesis syndrome, cannabis and chronic pain. We have our cardiovascular disease. We also have nano emulsions. This is really for somebody who's ready to start increasing their knowledge now, because either you want to incorporate it into your current practice, or you want to bring it back into your institution that you're working at and start being able to help patients navigate. This is for the here and now. One of the biggest issues that we see right now is the lack of education among healthcare providers. And we have programs like the University of Maryland where you can get a master's in cannabis therapeutics, but that can take up to 3 to 4 years for you to complete. And again, our patients are using it now. So we need to have somewhere we can start. Pacific College Health and Sciences is sort of in the middle. It's an 8 college credit course that you can complete over 6 months. And there are 3 courses within that focus on endocannabinoid system and pharmacology, clinical implications, and then you have a capstone project for your last class where you can design it around education or coaching or advocacy to go out there in the industry and start incorporating that in there. And I'm sure we're going to see more and more programs pop up. There are no programs that certify you or accredit you. And I want to make sure that's really clear. The American Cannabis Nurses Association is working towards credentialing with the ANA and ANCC. It's probably another 5 years before we'll actually see that come to fruition. So if anybody tells you that they are credentialing you or that you're going to be certified, I would be a little bit skeptical about that. Now, you can be competent. So for any of, if we have any oncology nurses on here with the biotherapy and chemotherapy that we would take through the Oncology Nursing Society, we were competent at the end, but we weren't certified. And so these are some groups to consider that are out there that are trailblazers and are doing incredible work to help push this movement forward for nurses who are interested in the industry. I encourage you to check them all out. Just waiting for my little thingy to pop up here. Okay, well. Okay, likes to jump ahead. So what are some of the challenges and opportunities? Well, as I've said several times, cannabis remains a Schedule I drug. So what does that mean? Well, it can be difficult to set up your business when you work with cannabis. It took me years to get a bank account, and I don't even touch the plant. I was shut down by PayPal and Stripe and Square and Wells Fargo. The minute they hear that you have the word cannabis in your practice or business, they will not do business with you. The American Cannabis Nurses Association lost multiple bank accounts because we had the name cannabis in our title. We finally found a company that would work with us, and we were told by multiple different banking organizations, if you just changed your name, we would do business with you. It's like, no, I'm sorry, we're not going to do that. It can be difficult to get insurance. You can also have a hard time finding a space because landlords may not want to rent to you. Now in the post-COVID era, or in our COVID era, a lot of people can do virtual, which is great. And telemedicine, telehealth is really the way to go. And the stigma. Sometimes, when I first started this, I'll never forget, I had somebody, I'd posted on social media, and she came up to me and she said, "Are you serious? That was a joke, right? You're not really going to do this." And I said, "No, I'm serious." She's like, "So you're going to be a pot doc, a pothead, a drug dealer?" And I said, well, I might be some of those things, but we have 80 years of prohibition that have led people to sort of develop these ideas and theories around cannabis that we're really starting to disprove. Of course, there's no formal training or standard of practice, so it's kind of all over the place, right? How do we know who to trust and where to go? Those organizations that I talked about, those resources that I mentioned for education, those really are the people that are trying to do the most rigorous, evidence-based, up-to-date education and information for people. And as I've mentioned a couple times, most states' boards of nursing have not officially adopted the NCSBN guidelines. And I do think we're going to start to see this shift, especially now that we have, potentially half of the states could have adult use by the end of 2021. They're just not going to be able to deny this anymore. But what you can do, oops, where'd that go? Okay, you can start a coaching practice to start working with your patients. We can educate, that is within our scope of practice. So a lot of times if you have holistic background, or you're coaching your patients for other things, you can always bring in cannabis as part of that. It's pretty easy to do that. You can provide education to your community and your place of work. So as things open back up, you might be able to either do boots on the ground where you go into cancer support communities and do a talk for that community. It's a great way for you to also get clients for your coaching practice. You can also, bring that education into your place of work. I have one of our members right now at ACNA works for a major university here in California, and her education has been so valuable to them that they're considering creating a job where she's actually called a cannabis cancer nurse navigator, because so many patients are asking about it, and she has been the go-to because she decided to educate herself. So it's a great way for us to start normalizing this and really bring it in at that level. And then, of course, for those of us who, want to make some extra money, there are affiliate programs out there where you can sell CBD products that you trust, that you vetted, and make a little bit of money that way. And we hope to see a shift where nurses start to work in dispensaries. This is a little bit challenging right now because our wages are a little bit more than they want to pay. And because, again, it's a Schedule 1 drug, these dispensaries and cannabis companies are not afforded the same tax write-offs as other businesses. So the cost of doing business is quite high. And of course, rents go up when they find out you're going to be a dispensary. So there's a lot of cost associated with running these dispensaries. And you could also consider working with a CBD company. Again, so much misinformation out there, or not enough information out there for patients, that I do think nurses can add a lot of value to these companies because we give instant credibility. 19 years running, we are the most trusted profession. We know how to collect data. We know how to talk to patients. So brand loyalty, brand recognition, brand credibility, that's a lot of what nurses can bring in this space. Okay, I think that might have been the last slide to ask more questions. Yep, great. So I want to make sure we have these last few minutes for questions that may have come up. And I know if that didn't answer questions around education and opportunities, happy to expand on that.
Absolutely. We had one question that I wanted to address. I know you were chatting about the use of alcohol or other substance abuse, and a nurse asked what modifications are recommended, if any, based on history of substance abuse.
Yeah, it really depends on what their substance abuse was. And, I usually dive into that a little bit more. I've worked with people who are clean and sober. They may have had a history of alcohol use. I have had some patients who actually had a history of substance use with THC. And we have tried CBD because they're in excruciating pain. So, in those situations, I'm probably going to look for a cannabinoid that is not going to be impairing or jeopardize their potential sobriety. And there are some cases where I may just say, this isn't the right path for you. But a lot of times those patients who have a history of substance use, like with opioids or something like that, really don't have very many options. So for me, it's always a risk versus benefit analysis.
Okay, awesome. I think that we had a question about where will the slides be available. So everyone that attended are actually RSVP'd. We're going to send out the recording and the slides as well as some resources to y'all after the event. So expect that in the next 24 to 48 hours. We have a question about Nasima asked, oh, hi, Nasima. She's one of our favorites. She's one of our former hosts. And she's got great, if anyone has any finance questions, you can check out Nasima. What role do you see nurses playing in dispensaries?
Yeah, education for sure, meeting with a patient. So again, right now we're seeing an increased use among older adults, usually 55 and older, and really reviewing for potential harms with medication interactions. So I could see nurses doing, like a medication reconciliation. Also making sure that they're preparing these patients for potential side effects, and that they are educating them on proper dosing, and making sure also proper routes of administration. One of my favorite, it's not a favorite story, but one of the stories I like to share that kind of drives home the point is Here in California, in the Bay Area, we have a retirement community called Rossmore with over 10,000 retirees. And they have over 200 clubs in this community. And their second most popular club is their medical cannabis club. And so we get dispensaries from all around that want to come and, get the older adults in this community to come to their dispensaries. So they'll often do like a party bus. So pre-COVID, they would do a lot of these party buses, and they would bring residents from this community to their dispensary and host them and provide them with product samples and things like that. One of the biggest misconceptions out there is that tinctures, which are usually oil-based in the cannabis space, that these tinctures work quickly. And my experience is that they often follow the pattern of ingestion, meaning that oil-based tinctures can take sometimes up to 2 hours before they feel the effects. So this group of older adults went to the party bus, got to the dispensary. They were offered a drink with a couple drops of a tincture in it, and they were told this is going to work in 15 minutes and it only lasts an hour. So they all agreed, and it was THC, and they took it, and they all kind of looked at each other after like 30 minutes and said, well, I guess that didn't work. Finished their tour, got on the bus, got home, and that's when it hit them, when they were getting into their cars ready to drive home. So I really see nurses playing a significant role in reducing harm and reducing misinformation.
That's awesome. I love that. Let's see. Someone asked, I guess, more about the future, or I guess the current and the future of employment opportunities, like where to find those. Do you know if you have any connections to dispensaries looking for nurses, and kind of what you think about what will happen once the tax code 280E is repealed? Will there be more employment opportunities?
I think so. I think as cannabis companies, dispensaries, CBD companies are offered the same tax benefits and the cost of doing business isn't so high, they might start to see the value of, hiring a nurse. I always encourage nurses to reach out if they're in a state that has either medical or adult use, to reach out. Oklahoma has really embraced nurses in their dispensaries. Maryland requires a clinical director, and so registered nurses can actually sign up to be a clinical director. You don't have to be a nurse practitioner. Some states are putting it within their laws for the dispensaries to operate with a medical professional. So you can always lobby and advocate for that as well. Call up CBD companies and see if you want to work with them as well, offering education and maybe, consultations with some of these companies for patients who do have complex medical questions. It's a great way for these companies to avoid risk. I always say it's risk mitigation. And I think we'll see, like at Leaf 411, as we expand, because we are a national hotline, we're going to start hiring more nurses, and we envision these nurses being able to work from home in their states to help patients. So I do see it growing. And if federal decriminalization happens this year and next year, I just think it's going to explode.
Okay. Let's see. We have a question. Have you seen marijuana used for medication-assisted treatment for alcohol withdrawal?
I haven't actually seen any research on it, but I've had many patients come to me who want to reduce their alcohol intake. So I have helped them use cannabis to help reduce their alcohol intake, and some actually come off of it completely. There's definitely some research that CBD can help with some of our pleasure reward center in our brain, helping to kind of block that so that we're not prone to addiction. We've seen it with heroin, but I don't think specifically in alcohol. So it's all anecdotal at this point.
Okay. And someone also had a question about its use with COVID long haulers, the people who are still dealing with the effects of COVID. Wondering if inflammation, some of the other symptoms that continue post-COVID infection, can be treated with cannabis.
Yeah, I think that's such a great question. I mean, we don't have any clinical trials to demonstrate that it could help. We have a lot of animal data to demonstrate how the role that cannabinoids play in inflammation. There was a really small study in Israel of about 50 patients who were hospitalized for COVID. And it was randomized placebo where they gave half of the hospitalized patients CBD and the other half placebo. And the patients who got CBD actually had decreased clinical course. So they were in the hospital less compared to the placebo group. So they recovered faster. For long haulers, who may be dealing with symptoms, I do think cannabis shows a lot of promise in managing symptoms. So depending on the symptoms they're experiencing, it certainly might be worth exploring. I haven't seen it make it worse. I did have one patient who had a vaccine reaction who wanted to use it post-vaccine. And, again, there's not a lot of clinical studies out there to demonstrate how much you should take or how often you take it. So it's something that they would have to explore.
Okay, thank you for that. Let's see, we still have time for a couple more questions. MAPS has been working extensively to bring plant medicines into the therapy setting. Has there been any movement into introducing cannabis into similar therapeutic settings? I'm not sure what MAPS is, to be completely honest.
Oh, I'm gonna forget what it says.
You can throw it in the chat, that'd be great to the nurse to ask the question.
So the question is, are there any efforts to bring cannabis into
the therapy setting?
Oh, like mental health therapy setting? Yeah, I would love to see. I mean, I know we're looking at psychedelics for PTSD, and we're certainly seeing some promise with cannabinoids for PTSD as well. So again, it does, for some people improve their consciousness. I have one patient right now who I'm working with his psychiatrist because when he consumes THC, and this is his psychiatrist was telling me, when he consumes THC, he is more open to diving into these memories. And he actually makes a lot more progress when he's on THC in therapy versus when he's not. So I do think we'll see an increase there as well.
Okay, that's incredible. Let's see. Do you think there will be a specific NP specialty that will be at the forefront of cannabis nursing in the future?
Yes. I know that Pacific College right now, they have an RN to BSN program. They also have a holistic focus. So the Pacific College nursing program is holistic in general. And they're currently going to launch their master's program, holistic nursing. So master's degree in holistic nursing. And we're hopeful that we can include a cannabis track in that, which will launch this fall. So it would be the first MSN in cannabis for nurses. And right now it's really an educator or coaching focus, but we do plan to expand for the advanced practice nurse who, especially in states where they have full practice authority, can really have this as a specialty so patients who want to use cannabis as a treatment can see an expert.
Okay, well, thank you so much. Well, I know that there were several other questions, but we're just at the end of our event, end of our time with Eloise. I just have to say, Eloise, this is so insightful. I learned so much myself, and I really appreciate you taking the time to educate us all. We really, really, really appreciate it. I think that we're going to be sending out a post-event survey. We would love, love, love for you all to fill that out. Let us know what you liked and what you didn't like. We do host, like Nicole said at the beginning, other events, so you're welcome to check those out and join us for any other future events. And Nicole, is there anything to add there?
No, you covered it. We really appreciate you, Eloise, sharing your amazing, vast wealth of knowledge with us. It was so helpful. And again, as Casey mentioned, we'd love to hear from you all how this event went for you. It's really important for us as we continue to add more topics to our event list. So thank you. That's it.
Yeah, thanks for having me. I really appreciate the opportunity.
Oh, you're very welcome. If you have time, you can check in the chat. A lot of people are saying thank you so much for your insight and information. So lots of great feedback already, Eloise.
Super. Thanks, everybody. I really appreciate y'all being here.